guys, welcome to my channel. Thank you so much for coming back. For those of you who are new to my channel, my name is Mercy. On this channel I talk about nursing, lifestyle, beauty, vlogs, and all that good stuff. So if you would like to join my family, please go ahead and hit the subscribe button down below so you can join my family. With that being said, let's get into today's video. A lot of people want to go into nursing, but they want to hear other people's opinion on certain programs or how the actual field of nursing is. And the specific question I get a lot is, how do I know if nursing is for me? So I have put together a few tips to help you figure that out. So a lot of people want to go into nursing, but they've never had like patient care experience. So I would say get a PCA job at a hospital or a rehab facility or a stay living, assisted living, skilled nursing facility, any kind of place where you have direct patient care. I would say get a job there and kind of fill it out, because most times a lot of the stuff the nurses do, the PCAs also do. I feel like that's going to give you the opportunity to see how nurses interact with patients, each other, with other co-workers like the doctor, the social workers, and families, and all of that. If you do get a job as a PCA, if there's a friendly nurse that you feel like you can confide in or you can talk to, ask them questions about, the actual nursing aspect of the job and see what they'll say. Another way to find out if nursing is for you is to also shadow. So if you're a nursing student and you're in school, and maybe you haven't had clinical yet and you just want to know if nursing is for you before you even go that far, see if you can shadow a nurse at a hospital or something like that. There's a lot of opportunities. Sometimes you can volunteer or ask your school. Maybe they have those kind of opportunities that they can offer you. Shadow the nurse for a few hours, especially at the busiest time, which is usually at MedPass. If it's morning shift, it's going to be earlier in the morning. If it's night shift, it's going to be, at the beginning of the shift. Shadow the nurse at those busy times and see what goes into nursing. You're going to have an opportunity to see the nurse pass meds, do treatments, communicate with the doctors, talk to patients, maybe do vital signs. You're going to be able to make your judgment to see if, this is something I actually like doing. A lot of times I feel like people have the wrong perception of what nursing actually is, and I was one of those people back in the days. When people see nurses sitting at the computer for hours at a time, they think that those nurses are looking for their next vacation or shopping online or just bored or something like that. That might be true maybe 2 to 5% of the time, but majority of the time the nurse is charting, because in nursing you have to chart everything. There's a saying in nursing that if you didn't chart it, it wasn't done. Let's say you go and administer some medications to Miss Mary. Now with computers and everything, it makes it a little easier than back in the day where you have to write everything down. If you administer a medication, usually what you have to do is scan the patient, scan the medication, do your 5 writes, and then pass the medication. But scanning it is kind of like charting it. And then after you administer that medication, you have to go back to assess the patient to see how the patient responded to the medication, especially with pain meds, to see what their pain level is, if their pain level is still the same or if it decreased or if it's getting worse. Those are the kind of things you have to chart. And you have to chart your objectives, which is things you saw with your own eyes. You have to chart your subjective, things that the patient, the family, the doctor, everybody tell you. If something went wrong or if there's a code, whatever happens, you have to chart. So nurses spend a lot of time on that as well. So when you see a nurse standing in the hallway, she's not just shopping, she's not just looking for her next vacation spot, she's actually charting, because that is one of the biggest thing in nursing that will get you in trouble. Another way you can tell if nursing is for you is if you're a people person. I wouldn't say you necessarily have to be a people person, but that's kind of important when it comes to nursing. Nursing is not a job where you go and sit in your cubicle and work by yourself or only have to talk to people when you talk on the phone. Nursing is kind of interactive in the sense that you're working with other people at all times. You're working with patients, you have to talk to them, you have to interact with them. Your other co-workers, like other nurses and physical therapists and occupational therapists, doctors, social worker, you're working with a whole bunch of people. You kind of have to have that people person skill to be able to do it. You don't necessarily have to make friends with everybody and constantly talk to everybody, but you also have to understand that when it comes to your job, you have to be able to communicate and interact with those people as necessary. So I would say that is a great way to tell if nursing is for you. If you feel like you're just not that kind of person, you don't like to talk to too many people at the same time, then I would say maybe look into something else. Another thing that's going to help you figure out if nursing is for you is your ability to work in a fast-paced learning environment, especially for new nurses. Your first job is going to be your first real learning experience. Even clinicals, I feel like, don't even prepare you as much. It just gives you the basics that you need to know to become a nurse. But when you become a nurse, when you're on your own and having to take care of patients, that's when you really get to learn. So So the first year is really difficult for a lot of people because there's a lot of learning that takes place, especially if you work on the med-surg floor or any floor really. You're learning every single day, from the policies, the procedure, the culture, everything you need to know for that specific job. You're learning and working at the same time, so it kind of takes a lot out of you. So I would say get prepared for that if you think nursing is for you. But if you feel like I'm not able to do that, I can't think on my feet that fast, I need a slower paced environment, maybe hospital nursing is not for you. There's other parts of nursing that you can go into that you may be able to fit in well, but maybe bedside nursing might not be for you. Another thing about nursing, a lot of hospitals have switched to 3 12-hour shifts. So if you feel like you can't work for 12 hours in a row, that may be another concern as well. Especially as a new nurse, you don't get to pick your hours, you don't get to pick what days you want to work. You're just lucky to find a job that is willing to hire you and teach you to be a nurse. So usually those hours are 3 12-hours a week, and sometimes it's every other weekend. Sometimes you work on holidays, and even those 12 hours sometimes turn into 13 to 14 hours. You have to maintain your license. Maintaining your license means you have to practice safe, you have to follow the state's rules and regulations for nurses, you have to follow your facility policies, you have to be a safe practicing nurse, and you just have to be a good human. So